future doctors, today we are going to see about enteric fever. So it is a fatal multisystem illness which is caused by Salmonella typhi and S. paratyphi, A, B, C. So Salmonella typhi causes typhoid fever and this S causes paratyphoid fever. About classification and nomenclature. So Salmonella, this is the gram-negative bacteria and it belongs to family Enterobacteriaceae. Now antigenic structures. So Salmonella possesses three important antigen on their cell wall which is based on which they are classified. So the antigens are somatic antigen, that is O, then flagellar antigen, that is H, and surface envelope antigen which is found in some species. So now let's see about the somatic antigen and flagellar antigen. So somatic antigen, this is the part of cell wall lipopolysaccharide. Flagellar antigen, this is made up of protein flagellin which confers the motility to bacteria. Then somatic antigen, in vital test O antigen of S. typhi is used, but in flagellar antigen vital test H antigen of S. typhi, S. paratyphi, A and B, these are used. Then O antigen, this is less immunogenic and this is more immunologic. Then O antibody appears early, it will disappear early as well as indicate recent infection. H antibody, this will appear late, it will disappear late and it will indicate convalescent stage. Now what do you mean by convalescent stage? It is the period in which body recovers from a serious illness, injury or surgery. Antigen, then when the O antigen, this will react with O antibody, it will form compact, granular and chalky clumps. This agglutination will take place as well as optimum temperature for agglutination is 55 degrees Celsius. But here in H antigen, it will react with H antibody and it will form large, loose and fluffy clumps. And here agglutination will take place rapidly, as well as the optimum temperature is 37 degrees Celsius. Then serotyping of Salmonella is based on the O antigen, and here serogroups are differentiated into serotype which is based on H antigen. So this was the difference between O and H antigen. Now we are going to see about pathogenesis. So Salmonella are transmitted by the oral route through the ingestion of contaminated food or water. Dose of Salmonella is higher than that of Shigella. Now minimum 10 to the power 3 and 10 to the power 6 bacilli are needed to initiate the infection. So this much bacteria are needed for the infection. We are going to see about risk factors. So this promote transmission, including conditions which decrease stomach acidity, which is less than 1 intestinal digestion or higher Helicobacter pylori infection, as well as intestinal integrity, that is the inflammatory bowel disease, prior GIT surgery or suppression of intestinal flora by antibiotics. Now entry to the epithelial cell lining, the Salmonella will trigger the formation of membrane ruffles in the cell membrane of M cell. Then this ruffle will reach out and this will enclose the adherent bacteria within large vesicles. And this process of uptake, it is known as bacteria-mediated endocytosis, that is BME, which is mediated by type 3 secretion system. Following the entry, the bacteria will remain inside the vacuoles in the cytoplasm. This will enter the macrophage. Then Salmonella will contain vacuole which crosses the epithelial layer to reach the submucosa where they are phagocytosed by macrophages. Will survive in the macrophage. Then the S. typhi induces the alteration on its surface so that it is no longer susceptible for the lysosomal enzyme of macrophage. In this way, Salmonella will survive inside the macrophage. Now primary bacteremia. Now what do you mean by bacteremia? It is the presence of bacteria in the bloodstream. It can spread via lymphatics to enter the bloodstream. This Salmonella will spread. This bacteria will disseminate through the reticuloendothelial cells that is present in liver, spleen, lymph node, bone marrow, and other organs such as gallbladder, kidney, lungs, where further multiplication will occur. Now, when there will be secondary bacteremia, so that will be the cause of the onset of the clinical disease. So this was all about how the bacteria will cause infection. Now we are going to see about clinical manifestation of the enteric fever. The period of enteric fever, it is 10 to 14 days, and the enteric name is so named because of the mode of transmission, that is enteric route of its causative agent. So first clinical manifestation is fever. So step ladder fever will be there. So fever rises gradually to a higher level with every spike and then falls down but does not touch normally. The symptoms are headache, chills, cough, sweating, myalgia, arthralgia. So this was about fever. So now we are going to see about second clinical manifestation, that is rashes. So it is also known as rose spots. So that will faint salmon-colored blanching maculopapular rash on the trunk and chest, which is seen in the 30% of patients at the end of first week. Then early intestinal manifestations also there, so such as abdominal pain, nausea, vomiting, anorexia. Anorexia means loss of appetite. Then third is important sign, in which include the hepatosplenomegaly, then epistaxis, then relative bradycardia. There can be complications also such as GI bleeding, intestinal perforation. So this can also occur in the third and fourth week of illness. And fourth is neurological manifestation, rarely, which includes meningitis, velar ataxia. So this was all about clinical manifestation. Now we are going to see about lab diagnosis. So first is specimen. So type of specimen to be collected depends on the duration of illness. The preferred specimen to be collected are first week of illness we can collect from blood culture, bone marrow or duodenal aspirate culture. Then in the second or third week of illness we can collect from serum specimen for serology, that is for vital test. Then third and fourth week of illness we can collect it from urine and stool culture. The second is culture and identification. So blood culture, it is the ideal method for the diagnosis in the first week of fever, which becomes positive in about 90% of the cases. So what is blood culture bottles? So 8 to 10 ml of blood, it is collected in the blood culture bottle, either conventional blood, that is from the brain heart infusion medium, or monophasic or biphasic, or automated bottle such as BACT or LED. The next is about incubation. So blood culture bottles are incubated at 37 degrees Celsius and Salmonella are non-fastidious and growth occurs within 24 hours. Then from positively flagged blood culture broth, the subcultures are made onto the blood agar and McConkey agar. So blood agar and McConkey agar, two agars are used. Then colony appearance. So blood agar, it is the non-hemolytic moist colonies, and McConkey agar, the colonies are round, pale and non-lactose fermenting. Then third is stool and urine culture. So it is useful for isolation of Salmonella in the third and fourth week of the illness. Remain positive even after the antibiotic treatment. And media should be used to inhibit the commensals of stool. So this was about stool and urine culture. Now we are going to see about culture media which are used in the urine and stool examination. First is enrichment broth such as F broth, tetrathionate broth and gram-negative broth, these are used. And in selective media such as McConkey agar is used. So next is DC, that is deoxycholate citrate agar. It produces non-lactose fermenting pale colonies with the black center. The next is XLD agar, that is xylose lysine deoxycholate. It produces red colonies with the black center. Then Wilson Blair's brilliant green bismuth sulfite medium. This is particularly useful for isolation of S. typhi for heavily contaminated specimens. And S. typhi produces characteristic jet black colored colonies with a metallic sheen due to production of H2S. Then third is culture smear and motility testing. Smear made up of colonies reveals the gram-negative and non-sporing non-capsulated bacilli. They are motile with a peritrichous flagella. Then fourth is identification of Salmonella, that is from the colonies. It is made either by the conventional biochemical test or automated identification systems. So first is conventional biochemical test. It is catalase positive and oxidase negative. Then indole test, it is negative in this. Citrate test is negative. UDS test is also negative. And TSI, that is triple sugar iron test. This shows alkaline acid gas present. But here are some exceptions, that is exception of S. typhi, which is anaerogenic. Automated identification systems, LDTO off and VTIC. So these two tests are used in the automated identification system. Then fifth one is vital test. It is one of the most oldest and most widely used serological tests used for the diagnosis of enteric fever. The principle of this test is it is the agglutination H and O antibody against the S typhi and S paratyphi A and B are detected, and they are measured in the patient's sera by using O and H antigen. 4 antigen used, that is O antigen of S typhi, that is TO, then H antigen of S typhi, that is TH, then H antigen of S paratyphi A, that is AH, and H antigen of S paratyphi B, that is BH. Now we are going to see about Vidal test results and their suggestions. Rise of TO and TH antibody, it means enteric fever due to S typhi. Rise of TO and AH antibody, it means enteric fever due to S paratyphi A, and rise of TO and BH antibody, it means enteric fever due to S paratyphi B. Then rise of only TO antibody, it means recent infection is there due to S typhi. Rise of only TH antibody, it means convalescent state, and rise of all TH, AH, BH or AB, all the things are rise, then it is post TAB vaccination. So this was all about Vidal test results and their suggestions. Now we are going to see about procedure. So patient serum is serially diluted in the normal saline in the test tubes. These are done as 1:10 or 1:640 dilutions. 4 such states are made to each state of diluted sera, and the respective 4 antigen suspensions are made, that is TO, TH, AH and BH. Now these are added in this. Now test tubes are incubated in the water bath at 37 degrees Celsius overnight, and the results found are highest dilution of sera at which agglutination occurs is taken as antibody titer. Then O antigen appears as the compact granular chalky clumps, disc-like pattern with clear supernatant fluid, and H antigen this will appear as large loose fluffy cotton woolly clumps with the clear supernatant fluid. Now if the agglutination does not occur, then button formation occurs due to deposition of antigen and supernatant fluid remains hazy. And O antigen appear early and disappear early, and it will indicate recent infection, and H antigen this will appear late and disappear late. O antibody are serotype and non-specific. So this was all about Vidal test. Now we are going to see about 6th one, that is molecular methods. So several polymerase chain reaction, that is PCR reactions, which are based on the mixed PCR, and 7th one is other non-specific methods, CBC counts seen in the 15 to 25% of the cases. Now this is all about the lab diagnosis. Now we are going to see about treatment. So prompt administration of appropriate antibiotic, it will prevent severe complications and reduces mortality by less than 1%. Now treatment of the cases, it depends on the susceptibility of the strains, and the currently recommended drugs are as follows. So 3rd generation cephalosporins are used. Triaxone, drug of choice for the empirical treatment. It is given 1 to 2 gram per day IV for 10 to 14 days. Then second one is azithromycin, that is alternative drug for empirical therapy. The advantage of this is it is given orally 1 gram per day for 5 days. Then third one is fluoroquinolones, example is ciprofloxacin, and because of increased drug resistance, it should not be given empirically, but it can be given only if found susceptible. And it is given as 500 mg twice a day for 5 days, and it is given orally. It were used in the past. This was chloramphenicol, cecilin, and clotrimazole. Now this was all about enteric fever.